All right, hi guys, Lisa from the Hub PT here, and I'm going to introduce Mrs. Leona Ham, who is a physiotherapist in Okotoks and the owner and operator of Finishline Physiotherapy. Leona, I'm going to let you carry on and introduce yourself and give us a little bit of insight into how you became a physiotherapist, how long you've been doing it for, and what led you into your current primary focus of practice right now.
All right, awesome. Thank you for having me, Lisa. I appreciate you interviewing me.
Thank you for being here.
So I've been a physiotherapist for 18 years. I graduated in 2002. Prior to my 4-year degree program as a physiotherapist, I actually completed a certificate in athletic therapy, and it was athletic therapy that intrigued my interest in physiotherapy. And so I certified as an athletic therapist actually while I was going through my 2nd year of my physiotherapy degree, which was very nice because it provided me with a source of income. As I was going to school, I worked with hockey teams to help pay my rent and pay for my books and that sort of thing, as I continued to work, or as I continued to do my degree for physiotherapy. So that's what brought me into the field of physiotherapy. And I practiced as a sport physiotherapist slash athletic therapist for as my primary practice for, I would say, 6 years. And then I moved into pelvic floor physiotherapy. And now I would say the majority of my clientele is pelvic floor physiotherapy. In addition to that, I do see children. I actually just saw a baby today for something called plagiocephaly, which is head shape issues that can happen with infants. And so I have that in my practice as well. But pelvic floor, I started it because of my own personal experience with my 2nd pregnancy with my son. I was playing baseball. I was only about 2 months pregnant, and I took off running to first base, rounded first base, heading to second, and I leaked urine as I was doing that. And I was absolutely mortified. Luckily, I was wearing black pants and nobody had any clue. And it wasn't a huge amount of leakage, but it was still mortifying to me. So that's what prompted me to start looking into the courses and the education around pelvic floor physiotherapy. So I did my first education in the fall of 2006 when I was about 6 or 7 months pregnant. And then I've continued to take courses over the years since then. I usually take anywhere from 1 course and several webinars or conferences, or do research on my own per year. And sometimes I've done 4 courses in a year as well. It just kind of depends on finances and also where the courses are being offered.
Yeah. So I guess we'll go back to when you leaked urine the first time. Did you, with all of your education, did you know ahead that that was a potential thing that could happen as a female, or was it a bit of a shock and surprise for you at that time? And hallelujah for black pants.
Yes, that's right. So I was aware of it because when I was in university, I luckily had a job working with physiotherapy clinics in the city. And so one summer I actually was a receptionist for a pelvic floor physiotherapist. So I got to learn quite a bit just through talking with her. And then when I was in school, we had I think a 2-hour lecture on pelvic floor physiotherapy where they showed us the muscles and told us what incontinence was and that sort of thing. So I did have an idea at that point in time, but I've always been very active. I've always stayed fit. So it was still a surprise to me because I felt like, how can this happen to me? I'm not overweight. I'm very active. I'm strong. I'm fit. So I was in quite a bit of denial that that could happen to me.
Yeah.
And what I've learned over my years of practice is it doesn't matter how fit and strong you are. Those muscles are being stretched when you deliver a baby, and there's a lot of pressure on them when you are growing that baby inside you. And so there is a lot of changes that occur. And then on top of that, throw in the hormones and the increased fluid levels, all those things that can occur for women that when they're pregnant.
Yeah, and you kind of touched on there, like myth busting a little bit, that your body weight actually doesn't play into the risk of or the chances of a pelvic floor issue. It is not a body mass consideration. It's just something that happens to a handful of us. So for many of us listening, some people might not actually understand what the pelvic floor is. Obviously, we understand that it's down in through the pelvic region, but do you mind going through a little bit of what the pelvic floor is, kind of looks like, and how it functions?
Most definitely. I'm just going to grab a spine here. So this is my spine. So if we're standing, there's the pelvis, and then if we lay on our back, there's the bum facing you, essentially, so the bottom part of the pelvis. So these are the hip bones here, the ball and socket, and then this is the front part of the pelvis. So this is the pubic bone here, and then in here is the sit bones, and then there's the tailbone. So the pelvic floor itself, that has layers of muscle and fascia. So the outer layer is fascia, and then just beneath that outer layer is the first layer, or superficial muscles. So those muscles attach along this region of the pelvis on the right and left side. Okay. And then there's another muscle that comes across on the right and left side. So I tell people that forms almost a triangle orientation in the pelvis. And these muscles are actually in the labia. And then the other group of muscles that are deeper, more inside the vagina or the anus and rectum, they attach underneath the pubic bone. They go out towards the sit bones and then back to the tailbone on the right and left sides of the pelvis. So they form more of a diamond orientation. Mm-hmm. So these are essentially the bottom of the core. When we talk about core muscles, the pelvic floor forms the bottom of the core. And then the top is actually formed by the diaphragm. And there's actually a connection between the diaphragm and pelvic floor that a lot of people don't realize is there. And in terms of how the pelvic floor responds to those pressure changes with our breath.
Awesome. So when you work with some people, and I'm taking a bold guess here, but you work with teaching them on some breathing foundations as well. And do you try and teach that balloon or like rain barrel method of trying to expand, filling that balloon up and down and out when you're inhaling, and then being able to contract it as you exhale? Or do you have the different type of approach?
So that's a starting point for sure, because generally when we breathe in, the pelvic floor is opening and expanding. So that diamond orientation that I was describing of those deeper muscles, when we inhale and there's an increased abdominal pressure, those will open and widen. And then when we exhale, they'll narrow and shorten. Mm-hmm. And shorten is maybe not necessarily the best word, but when you're talking to people that don't really understand muscular tissue, that's the best way I would say to describe it. So squeezing those muscles on your exhale, anatomically and physiologically, seems like that would be much easier, and that is the case. Pretty much most people that I assess will get better tension in their pelvic floor muscles if they're exhaling and squeezing. But sometimes there's a learning component involved with just the breath itself, because people will often work harder than they need to when they're breathing. And so sometimes you just have to focus on the breath before you even bring in the pelvic floor, because their breath will definitely influence how they use those muscles.
Cool. So then let's jump backwards a little bit, and outside of the pelvic floor therapy, physiotherapy, you do treat other typical physiotherapy requirements as well. Do you want to go over some of those that you work with for different clientele?
And a lot of my pelvic floor patients are very active moms. And so they want to get back to running, or they want to get into their CrossFit or their HIIT training and that sort of thing. So definitely my sport therapy background and my athletic therapy background plays a role in that part. But in terms of other things that I'll see, hip issues, and when it comes to the pelvic floor, I try to encourage other physiotherapists, if they have a patient that has hip issues or low back issues or pelvic issues that are just not resolving, that those patients may benefit from pelvic floor physiotherapy, because there is likely a component of pelvic floor involved with that. So I will see a fair number of people for hip and low back and pelvic complaints that other therapists have potentially referred to me. And then I'll see people that have come in with the Achilles tendon or the shoulder issue, neck issues, that sort of thing. So I still will see people for those types of conditions, but it's definitely not my main clientele at this stage in time. I tend to be more, we're not allowed to call ourselves specialists unless we pay a lot of money to our professional organization and do some research and courses and that sort of thing. But essentially I am a specialist in pelvic floor physiotherapy, because I've taken courses that not every physio out there will take, just because they're not comfortable with the stuff that I do. Necessarily, or comfortable doing what a pelvic floor physiotherapist is often required to do.
So then let's role play here. I'm a former athlete. I had a kid, and I now find that every time I jump on the trampoline, I leak more than usual. I know I need to go to the bathroom first, but then I go jump on the trampoline, and it's still like, it's just on the cusp of leaking, and I'm like, I don't want to deal with this anymore. So I come to see you. What would my experience with you be like?
So I have a detailed intake form that I usually get patients to fill out online, or I can email it to them and then they can print it off and fill it out, and I will review that intake form with them. And that just kind of guides me into potentially other things that might be contributing to their symptoms as well. So after I go through the intake form and maybe ask a few more questions, then I'll explain what a pelvic floor exam from my perspective and my level of training involves. And so I'll describe the pelvic floor muscles and how I assess those muscles. And then from there, we are a profession that has to ask for consent all the time. So even though the patient usually has signed a form consenting to what I'm going to do, I still continuously consent with them. And then also give them the ability to withdraw their consent. So once I have their consent, I will do the pelvic floor exam. And so that involves the patient slipping out of their pants and underwear and usually laying it on their back. That's what I start with. And then from there, I will do an assessment of the pelvic floor as they attach in the vaginal area and the onto the tailbone around the anus as well.
Okay, so is that that's more just like a physical assessment, feeling and assessing?
Yeah.
Okay.
Yeah. So I assess the muscles in a variety of ways. So I assess strength, speed, coordination, endurance.
Okay.
And then I assess the attachment points of the muscle. And then I assess for something called a pelvic organ prolapse as well, which involves changing their intra-abdominal pressure.
Okay.
Within the assessment too, I look at breathing and see what their strategy for breathing is, and maybe give them tips on that and exercises for that as well.
Okay.
And then sometimes, depending on the complaints and depending on the time, it may have to wait till the second appointment, but I may do an assessment of range of motion and strength in general of the back and the hips as well. So sometimes that might be involved in the assessment.
Cool. So, and I guess some indicators could be like not just leaking, but like you mentioned earlier, chronic low back, hip discomfort, those aspects that could be affected by or affecting the pelvic floor, that is worth getting checked out by someone like yourself who takes a stronger education process in the pelvic floor world rather than just general physiotherapy, correct?
Correct. Yes.
So then for guys, let's say a guy it's diagnosed as a psoas injury, just super discomfort, likely more so like overuse or something, but it, runs up in the hip, the pain's really discomfort or uncomfortable. Would it be worth having someone like that come to you to have their pelvic floor checked? Because men have pelvic floors too.
They do, yeah. So I have added male pelvic floor to my practice. I just did some courses in October, and was planning on doing another one in June until everything hit with this change in our world, because the course had to be canceled, obviously. But in terms of men, yeah, I do see men with pelvic floor. I haven't seen a lot because it is newer to my practice, and also not necessarily something that all men are comfortable with. Mm-hmm. But I can assess their pelvic floor, and you can do it through an internal exam as well. But there is, even from an external standpoint, there's things I know that maybe...
Sorry, parenting, working from home. Yes.
You said you'll call me outside to watch TV.
All right, sorry.
No worries.
We'll start again. So for the men, it's new to your practice, definitely uncomfortable for them because it's not something that's openly talked about. I mean, it's uncomfortable for us women as it is. And I think it's safe to say we're far more open on like our female challenges that we have, at least within our circle of trusted girlfriends. And men don't talk about that stuff. So let's carry on and how you treat and work with them.
So yeah, it is a little bit different, and it's still early in my practice, and so I'm still experienced. I'm still not as experienced as I am with women, but there is a lot of things that you can transfer over for sure. Through my practice with women over the last 10 years, there's lots of things that I've been able to transfer over. But yeah, the men that I've seen so far are actually very open because they often have either had prostate surgery, so they've had a prostate cancer, and so they often will have leakage, men will, after prostate surgery, and so they just want it to stop, or they want any sort of help. And then I've seen a few men with pelvic pain, and they've had pelvic pain for several years, and they just would like that to go away. But it is definitely a different environment, and there is a much more explaining and then just calming their nerves, because they are much more nervous compared to, I would say, a lot of the women that I see. Not that I haven't seen very nervous women, but definitely in general, it's an unfamiliar examination for men. It's not something that they have maybe as often or as regularly as women do. So, but so far, I've had awesome feedback from the men that I've seen, and they have had good success with the stuff that I've been able to give them. So
that's fabulous. That's great. So is it safe to say that from being like a standard, no, I hate saying standard, but we're just going to say general, just like general practitioners for doctors, a general physiotherapist, and then converting over into where your greater focus is in this more intimate range, you're safe to say your compassion levels and your approach has changed a little bit?
Most definitely. Yeah, most definitely. And it's a practice that those of us that have been practicing for several years as pelvic floor physiotherapists, we definitely suggest that new graduates right out of university do not go right into pelvic floor physiotherapy, because it's experience, getting to know your patients, and I would say getting familiar and confident with the language that we have to use. We have to talk about vaginas, we have to talk about rectums, we have to talk about the anus. And then on top of that, we're touching those areas as well. And so it is getting familiar with that. And these are very sensitive areas. And they're connected so deeply to emotions and that type of thing. And so you have to have a degree of experience and skill in just what we call palpation, so touching those areas, which I can tell you is not often, if ever, there when you first graduate. You tend to just dig right into the tissue, and you definitely don't want to do that. So it is learning the difference between a firm pressure and a delicate pressure, but still able to feel things with that delicate pressure.
Fabulous. And I'm assuming, much like massage therapists too, the more time you put in with that type of touch practice, the more you actually start to feel and understand the human physiological response to what you're applying to that client as well. So you're able to, in essence, read the body a little bit better as time goes on in your experience level as well.
Most definitely. And even reading your patients a bit better. In the past, I can definitely say that I'll have those patients that come in and they're great. They're so keen. And you'll tell them, I want you to do this exercise. You'll give them a prescription of an exercise, and they'll come back to you and they'll be not any better, if not worse, because they're so keen. And they thought, well, if she said that I should do 3 sets of 8, well, what about 3 sets of 20? Because I could easily do 3 sets 20, right?
Yeah.
So through my practice, I've definitely learned to read those patients in the beginning and learn to speak to them differently so that they are not coming back to me with extreme pain. And that's really important when it comes to the pelvic floor and the issues around the pelvic floor, because if you don't pick up on those patients, then they could really suffer in a different way than that shoulder patient does, just because of the sensitivity that's associated with the pelvic floor and the pelvic region that we're dealing with.
Well, and while they're crucial muscles, they're small and they can fatigue quickly. So you need to be very careful in your boundaries on those, right? And
Yes.
How do you motivate the people who are not keen and not wanting to do the exercises?
Yes. You know what? That is still, I would say, up for the jury to figure out. There is some people that I have learned to motivate, and often it's doing something that I know is going to show them that there's improvement. So it's kind of the trick of doing something and then maybe touching a sore spot and then doing something and then touching it again, or testing a muscle and it's really weak and then doing something and then the muscle is actually stronger after. So if there's something that I can do for that patient that will change either their pain immediately or change their strength or both, that's usually a motivating factor for them to do things. Sometimes you have people that are like an onion and they have a lot of layers and you can't figure out those things right away. So you just hope that you've educated them enough that they will be motivated to come back, because there can be improvement that can occur, but it's peeling away the layers of the onion to get to that core that's going to make the biggest difference. So those can tend to be the more difficult patients, but definitely the buy-in can be like, whoa, what did you just do there? Why am I stronger? Or why don't I have pain now when you poke there or when I poke there? That can often motivate them.
Cool. That type of feedback is usually like the picking the right carrot to dangle in front of the person, right? To keep them going. Yeah. Awesome. So what are some career highlights that you have gone through and experienced thus far?
So for me, career highlights that I've had have been, I would say, more so in my sport therapy, because in sport therapy, you get to travel and get to do major games. And I shouldn't say that everybody does, but I did get to go to a couple of major games before I had my children. So I went to trampoline and tumbling world championships and the trampolinist Karen Colburn, who's actually won a couple medals for Canada in the Olympics and World Championships. That was her first win in World Championships for a gold medal. So I was in Germany with her and the rest of the Canadian trampoline and tumbling team. And there was another athlete, I can't think of her last name, her first name's Rosie, who's actually also followed Karen's footsteps and done very well in Canada in the Olympics and such. So she was just starting when Karen was peaking. So that was exciting. And then I was a trainer for the men's and women's hockey team for Canada Games. So I was the Alberta trainer for the men's and women's hockey teams. And the team that I worked with, they won the gold medal. So Alberta came home with the gold medal for the men's side. And those athletes that were on both the men's and women's teams both moved on. Not all of them, but some of them I see in the NHL now. Devin Dubnyk was actually the goalie for the team, and he's still in the NHL as a goalie right now. I don't know who he's playing for these days, but he was one of the players that I worked with. And oh my gosh, Megan Mickelson, who played for Team Canada, women's hockey, she was on the female team, among a couple of other gentlemen that were on the team as well, that are in the NHL that I got to. So those were highlights for me in my career, I would say. Day to day, just getting those emails or having a patient come into your office and just appreciate how much change and just the fact that they came in the first time hopeless and now they have hope, and they've seen that side of hope, and they've actually experienced changes in the symptoms that they have or that they came in with. Those are also highlights of my daily career as well.
Isn't it so powerful when you realize that you're able to hand hope on a platter to someone who was not feeling confident or just totally insecure with whatever the situation was, and that you're able to give that to them and they can take however much they want and carry it forward for the rest of their life?
Most definitely. That is definitely the most rewarding thing, I would say, in your profession as well. Just people coming in and not feeling that they can exercise for whatever reason, and you can provide them with tools and methods to give them confidence in that, right? And so definitely in my profession, very similar. Just instilling that confidence that they can do it, and there is hope, and that they don't necessarily have to live with the discomfort that has brought them into my office and perhaps several people's offices before they come to see me.
Yeah, and from my side, it's really fun being able to give them permission to start wherever they are, and then leading them and guiding them to wherever they choose to take it afterwards, and making it known that you don't have to be a certain size, shape, or fitness level to go into a gym, seek out a gym, try something new, whatever the case may be. Just start where you are, and then there'll be nothing that'll stop you except for yourself come that point in your life too. So
yeah, most definitely.
Yeah. Okay, so I mean, we touched on highlights. Have there been any challenges that you've come across?
So I would say my challenges are, and continue to be, is just really getting the word out there to people on pelvic floor physiotherapy, and in particular moms, so childbearing women, that's the best time to go and see a pelvic floor physiotherapist, whether you're thinking of having kids or whether you're pregnant, and then definitely postpartum as well. And it's one of those things that it's a constant sort of, don't forget that there is pelvic floor. And even if the person doesn't have symptoms, prevention is key. And if this person has delivered a baby, those muscles have been significantly stretched. Sorry, excuse me just a second.
No problem.
So in terms of, I've lost my train of thought. Sorry.
Okay. Expecting moms, pregnancy, planning to have kids, or postpartum.
Yeah, so something that is not necessary, common knowledge, I would say, and to me, common sense even, is when we deliver a baby, there's significant strain and stretch on those pelvic floor muscles, as well as the surrounding ligaments and tissue. And so women that delivered a baby have essentially signed up for stretching those areas and straining those areas. And so we know that when we strain our hamstring or our biceps or our rotator cuff, we often need rehab for that strain. And we need to think of that the same for pelvic floor, is that those muscles have been strained. And even if they don't have any issues with bowel or bladder control or anything like that, if there was tearing, minor or major, or just the delivery itself, it's always good to just make sure that you do know how to use those muscles. Because 60% of women actually don't really do pelvic floor muscle exercises correctly. And then statistically, women can have issues that don't start until up to 7 years after they've had their last child. And so if you can prevent those statistics by seeing a pelvic floor physiotherapist, you may only need one visit just to know that you are doing pelvic floor exercises correctly, or to get experience and training on actually how to use those muscles and work those muscles.
Yeah, and you could have it prior to having a child or pregnancy or whatever, but there's the risk of a bladder prolapse. Hormones are highly involved in pelvic floor health and tone and everything as well. So getting a better understanding of your body through the help of a specialist and a professional is always to your greatest advantage.
Yes, most definitely. I would say the other challenge is keeping up to date with the research, because I'm a bit of a geek and I like to look at the research, and I like to make sure that I am doing what is most up to date and what science is saying. These are the statistics. This is what we're showing on the research studies that we've completed, that these techniques are helpful, or this is what we're finding, that sort of thing. And so the constant learning and reviewing, which is fun, but it's very time consuming because I do have a family, and my son in particular, kids guilt us, right? So he's very good at guilting me, my son. And he's more sensitive and not as understanding as my other child. So he does require more attention. And so when you have that and you're trying to also pursue other things and gain knowledge, it's that struggle of being the working mom, right?
Yeah, it's a absolute challenge of balance, that's for sure. And I mean, we know perfect balance doesn't exist, but I have one that needs attention and needs to know that we're all safe and secure, and so is she. And so there's a lot of give that's required, but I get it, trying to get in all that education and do the research and keep up with it. That is definitely a challenge for sure. And I think that's probably a very universal female challenge across the board, from all of the people within our industry that I talk with that are moms, working, running their own businesses, trying to stay up to date with education, all of those other things as well. So but it's necessary and we need to do it, or else we are doing our clients a complete disfavor, and then thereby doing ourselves a disfavor as well. So it's just plugging away.
Most definitely. Something more recently too that I've just noticed too, you being a businesswoman and having your own business, we use forms of social media to communicate, right? And so those various mom groups that exist out there and that type of thing, I think misinformation of, you'll get the questions and I'll see them pop up every now and then I'll see maybe my name's been mentioned, which is what alerts me to the question, like, who knows a pelvic floor physiotherapist? And then you'll see all these names come up, and they're great individuals, but they're not pelvic floor physiotherapists. Some of them are physiotherapists, some of them aren't even physiotherapists. And the layman, like these are not necessarily, these are people that are just, they don't know any different. So it's one of those things that kind of goes back to my first comment, is getting the word out there as to what a pelvic floor physiotherapist is and how we're trained differently. And our knowledge base is different from other practitioners out there, whether they be physiotherapists or chiropractors or massage therapists or occupational therapists, or trainers, or Pilates instructors, that sort of thing, that those are not pelvic floor physiotherapists. For one, they're not physiotherapists, or maybe they are physiotherapists, but they don't, a pelvic floor physiotherapist is someone that looks at the pelvic floor and assesses the pelvic floor.
So how could one go and try and confirm that, you know, XYZ is or is not a specialist within that pelvic floor physiotherapy community? Is there somewhere that we could go and do our research to make sure?
Yeah, you know what? Yes and no. So the college that gives me my license, which is the College of Physiotherapists of Alberta, they have Find a Physiotherapist on their website. Mm-hmm. And so they have a huge list of, physios do amputees. I say amputees because that's A. At the very top, it's alphabetized. And so depending on your knowledge, do you know that incontinence is bladder leakage? Because our college will have incontinence practitioners that treat incontinence, that sort of thing. And I would say the majority of the physiotherapists that are listed as under one of those categories would be a physiotherapist that's done additional education in pelvic floor physiotherapy, but not necessarily, because interesting enough, and it's something that we as pelvic floor physiotherapists, we meaning myself and other physiotherapists that practice in Calgary at various clinics, and have all the extra education and have put the time and the effort and the finances into gaining that education, we have tried to get legislation that it's a restricted practice, just like needling is, and also spinal manipulation. Mm-hmm. But so far we have not been able to get it known as a restricted practice. So somebody could essentially come right out of university, and they still aren't getting any longer of a lecture than I did 18 years ago. And they could call themselves a pelvic floor physiotherapist and start treating the pelvic floor. Now, that being said, are they actually doing what I do as a pelvic floor physiotherapist, or are they just calling themselves a pelvic floor physiotherapist because they're teaching people how to do Kegels by just telling them rather than actually feeling the muscles themselves to see if they actually are doing them. Okay. So it's just one of those things that I think we all have our struggles within our own professions around those things. And we'd love to say that everybody in our profession follows the rules and does what's best for the good of the people, but that doesn't always necessarily happen, and so it is a bit of a process. But that is the best way, is to go to our College of Physiotherapists and look on there, because I would say for the most part they are, or talking to someone like myself or somebody else. Lakeview Physiotherapy in Calgary is a very large organization of pelvic floor physiotherapists. Okay. So those physios would be able to tell people if that truly is a pelvic floor physiotherapist.
Good. All right. And then the other thing would be, like, you have your list of your referred people from Facebook land. Talk to them. Ask them questions. Make sure you're comfortable with the person. Probably your own personal instinct is going to give you the answer as to whether you want to work with that person or not, or if they're actually educated enough in that realm for you to be choosing to pay your hard-earned money for them to try and help you as well. So you have to advocate for yourself,
for sure,
no matter what. So don't be afraid to ask questions, and they can be very private questions, because this person should be comfortable with answering those ones.
Exactly. Yeah. Yeah.
All right. So
And
you touched, sorry, go ahead.
in our community, so when South Calgary, there's only two of us. And we're both in Okotoks. Myself and another physiotherapist that works at Momentum Physiotherapy, who's actually on maternity leave right now. So her and I are the only ones that actually have training in and have done additional education in pelvic floor assessment and treatment. And so that's also another way whoever watches this interview can find out, right?
Yeah. Okay, so you touched on earlier one piece of advice for new grads to get time in the trenches in like general population physiotherapy. Is there any other advice you would like to pass on to anyone in your field?
Find someone, if you're truly interested in it, find someone and ask them if they would be willing to mentor you. I've definitely had multiple mentors, not just one. So that would be something as well. Don't just stick to one mentor. Look for other mentors in terms of finding out how pelvic floor physiotherapy works, because they are often very passionate about what they do. And so they will be able to provide them with good knowledge that way.
Good. Awesome. Okay, before we go, favorite book or a book that you think everybody should read? Doesn't have to be in your industry, just a book that you think everyone should pick up and read.
Okay, well, it is in my industry, and it's called The V Book. It's a book that I read when I first started doing pelvic floor physiotherapy, and it's obviously based for women. I would say a general book would be There's a Headache in My Pelvis. So that's someone who has general pelvic pain, whether you're male or female. Those are books that can be helpful for understanding various things that can happen in our pelvic area.
Cool. Fabulous. Thank you very much, Leona, for your time and for choosing to go and put time and effort and passion into this more like micro field of physiotherapy. I know from the women that I've worked with and referred to you, they're indebted and grateful for the help that you have given them. And I have no doubt that there will be more women that are going, and men too, sorry, I should not pinhole people, but I know that there are going to be more people that are going to be benefiting from your help and your knowledge as well. So I want to say thank you, and I want to wish you the very best in the future of your career as well. No doubt it's going to be great. So thank you for your time, and thank you very much for this interview.
Thank you, and good luck. Hopefully your gym will be opening soon.
Fingers crossed. We'll see, and if not, we can always adapt one way or another anyways too. So there's always ways to make things happen.
That's right.
Yeah. Awesome. Thank you very much, Leona. And
thank you. Take care.
Thank you. Bye.
Bye-bye.